Give Dr. Danielle Carrera a big round of applause as she makes her way to the front here. Thank you, Dr. Danielle.
Thank you. Hi, guys.
So, oh.
Thank you.
I thought you were going to show a video of you poking and digging up sand.
Oh no, it's hysterical. Thank you very much. I feel privileged, and I just want to embrace this time that you, both Tim and David, allowed me to come here because I want to empower you guys. And my objective today is to educate you on becoming the CEO of your own health, your own healthcare. Super, super important. So all of you are entrepreneurs of some type, right? You want to start a company, own a company. It may be only revenue coming in of 5,000, 500, 5 million, whatever it is. Just know that wealth is nothing if you don't have your health. Super, super important. So I can give you all the statistics on Americans. I can tell you that 70% of them are overweight. 40% of them are obese. Majority of you are tired, inflamed, and you're just kind of over it with the system of healthcare. Why? Because it's become sick care. So let's be real. We all know about the white coat syndrome. You go in there, your blood pressure is elevated, all right? Why? Maybe not because you really have high blood pressure, but because you're nervous. Why does that happen? Because we usually don't have something good to tell you. It's not fun. It's not fun to go to the doctors unless you're having a baby or you're having some type of plastic surgery, right? So I want to change all that. I want to make it to where when you come to see me, when you come to see my team, you are excited. You want to know what your lives are. You want to track. And the best way to do this is to have data. So I'm going to bring you back with some of my education. I started off from the bottom. I was in healthcare. I got my psych degree, and I worked for Tampa General Hospital in the psychiatric center. I was an RN, and I really had to observe and understand that there's no healing going on physically unless you dealt with somebody's emotional and mental well-being. Couldn't touch them. The doctors couldn't touch them. They would never penetrate what was going on with them physically unless they went through and they found out the resource part, what the culprit was. Why were they sick? So as a nurse at the bedside, I started to look at the healthcare system, and you were being processed, not prioritized. So I decided I wanted to further my education. I wanted to make a difference. So I went back and I became a nurse practitioner. I loved it. I embraced it. One of my first jobs, I worked in the Harlem of Tampa, the worst of the worst. I would have prostitutes come in and they became my friends. They were there every single week because they had to get their shot of Rocephin. They had to get their azithromycin and their doxy because they would have gonorrhea and chlamydia. And I would try and educate them and be like, what are you doing? You can't keep doing this. I'm like, it's going to get to a point where it's not going to go away. But I only had 11 minutes allocated. By the time they came in and their blood pressure and their paperwork were filled out, I was scrambling just to do my assessment on them. So my education for them and the time to give them resources got shorter and shorter. This happened continually, week after week. I'd have MIs right in my room because they would not go to the emergency room or they'd never ever had health care before. There was nobody there to educate them. I would have patients come in where they didn't even know they had diabetes, but their blood sugar was so high, I had to call an ambulance to come get them. They were in ketoacidosis, immediately into ICU. I was watching the system that was broken, and I didn't understand it. I knew I had to get back to the education part. We had to set a foundation. So as months and months went by, I said, I need to educate myself farther. I want to become autonomous. I want to get my doctorate. I want to be able to open up a clinic to where I can focus on well-being and education for my patients. So I did. I went back for my doctorate. In the meantime, I went ahead and I started to work for an insurance company. So we all know about a very big insurance company that had problems a year or two ago. I worked for them. And their motto was for us providers to keep the patients out of the hospital. My motto was to keep them alive. So I would have patients come back from open heart surgery, and they would be in the rehab, they would be my patients, or they had fractured a hip, and I would have to keep them out of the hospital. So they had multiple comorbidities on top of that, right? They had hypertension, diabetes, COPD. So I was becoming the pulmonologist, the cardiologist, the psychologist, the intensivist, my moral, my value, my ethics, just so I wouldn't get my bonus taken away from me. And if they would go to the hospital, I would have to face repercussions. The system was broken. I didn't want to be a part of that anymore. But they paid me just enough to keep me there and kept me so exhausted because we had to turn and burn. I had 11 minutes to see these patients that I didn't know where to go. I didn't have time to apply to other places. And I knew there was something else out there for me. So I had family and friends, and this was before COVID, that would call me all the time and ask for a prescription. It would be a Saturday night, and at 7:30, I'm out to dinner, and I get these crazy pictures. I get, I don't know, throats, I get booties, I get rashes, I get whatever, and I'm like, okay, this has got to stop, right? So I created my own Carrera Telehealth and Wellness little platform. At that time, nobody did virtual. And I decided I needed to definitely turn on these patients, their family, my friends, and have something, God forbid, if it came back and I was audited. So that's how it started. I decided that I wanted to go a little further. I wanted to see about regenerative medicine. So in any platform, I know you guys, wherever, if it's IT, if it's medical, if it's real estate, you have to do continuing education for your license, correct? So I went ahead and I went to a conference in Orlando. And when we would go through as providers, we'd have to visit all the different tables to get signed off at. And there would be the pharmacy reps there, and they would have their different drugs, new and up and coming drugs. So there was the top 3. And one of them was Trulicity. Trulicity was one of the first semaglutide, tirzepatide, one of the first GLP-1s. Okay, so I went in there and she was telling me once a week injection for diabetes. So I said, okay, this would take the load off of my nurses having to monitor the patient so much. It would take the load off the patient having to be injected every single day. If I can pull back at pharmacy, this would be a win-win for my patients. So I got excited and I started implementing this Trulicity to all my diabetic patients. Well, beautiful things happened. So their A1C, which is a 3-month average of their blood sugar, started to go down. Cardiovascular events, as I learned more and more, primary and secondary, were reduced. They also, their lipid profile was going down. And my patients that couldn't get out of bed because they were obese, they started to lose weight and they started to move. And I got them into physical therapy. And before I knew it, they were coming down the hall towards me. Hey! So this got me really excited. But it was also noticed by other providers and by families and the physicians. And little did I know that Eli Lilly Pharmaceuticals was keeping watch and keeping data. So they came and they contacted me and they asked me to be their national provider speaker for Eli Lilly Pharmaceuticals. So I embraced it. Absolutely, I want to do this. So I went ahead and all over the United States, I would travel and I would train providers and I would train the staff and I taught them about Trulicity, this GLP-1. I got the insight for all the statistics, for all the data. And I realized this is where I want to be. This is a peptide. So you guys know peptides now, everybody's, because of social media, they're embracing them and they're becoming aware of them. Nobody knew what peptides were. The first peptide, just so you guys know, was back in the 1920s, and that is insulin. Peptides have been around for a very long time. They just haven't been exposed. Why? Because there's no money in it with pharma. So fast forward. Here I am. I'm the national provider speaker for Eli Lilly Pharmaceuticals. I have my little portal, Carrera Telehealth and Wellness, and I'm working this full-time job that's crazy busy. COVID comes. It blindsides me. What happens? The system doesn't support it. It fails it. All the primary care doctors' offices, they shut down. Your specialists, they shut down. How are you getting your meds? What happens if you're sick? You can't go in there. The hospitals won't let you in. So now what? Career telehealth and wellness, I was there. I started to pick up the slack. I had the privilege of working with a physician that was into holistic regenerative medicine. And he said, Danielle, let's go, let's do ivermectin. Let's try this. I said, why not? Let's try it. And we had live study research going. We were with FLCCC, that's Florida Critical Care COVID Alliance. So they were providers all over the world that were coming in and giving their studies with their patients. So what we saw was a reduction in the symptoms and the length of the virus. So I was like, oh my gosh, this is the realm. This is where I want to be. So here I am with this incredible peptide. Here I am with this alternative medicine. And all these patients that I was treating them with, they had multiple comorbidities, meaning they weren't healthy. They were very, very sick just on their own. So their kidneys and sometimes their liver was compensated, but it was still okay. Both the GLP-1 and the ivermectin didn't affect their kidneys or their liver. So I was like, win-win. Goes on, here I am, and I'm thinking, I have a purpose. How am I going to get this out there? How can I build prayer, telehealth, and wellness even larger, bigger, get it out to more people? Well, God is right on time. So it was 6 weeks into me dating my husband, who's in the back there. And I thought that I would be all cute. We were cycling, riding our bikes, and we're going pretty fast. And I grabbed the back of his shirt, being cute. And his front pedal went into my front tire. Now we're going fast. So what happens? My body catapults forward. I hit the crossbar, the handlebars and the crossbar, slammed my pelvis, flipped over the bike, ended on my head. The pain was so excruciating. I knew I fractured my pelvis. So I was in and out of consciousness, I heaving because the pain was so bad. My poor husband now, we were only dating 6 weeks, you can imagine. So then the ambulance comes and it turns into a trauma. So I don't know if you know this, Dr. Shipperty can tell everybody this, but the pelvic region, it's very vascular, the bones here. So it turns into a trauma because you can bleed out. So they get me over to the trauma bay. I'm in the emergency room and they're like, we have to take her back for surgery. Because it wasn't only a fracture, it was an open fracture. That means I was sliced up the labia. Can I say labia? Yeah. Okay. I was sliced up and the bone was sticking out. So I go back to surgery. I come out and it's 2 hours post-op. They have me back in my room and they inform me that the physical therapist is coming in a couple hours to get me up. And I was like, what? Are you kidding me right now? What is going on? But I was laughing and I was happy. And you would think it was the pain medicines, but it wasn't. It was because the load was lifted off of me. And it was time for what God had already had put in position for me. But I didn't slow down to acknowledge it, that I can now finally take a breath. I knew that I was going to have 3 months off. I was going to have to learn to walk again. I had a walker, physical therapy, all that. I didn't care. I embraced it. I was just so happy to get out of that broken system and to actually come into my own, embrace this time and realize I can make this a positive and I can bring it to my community. And I can help them. So what many people see as a crisis, I thought was a blessing. Now it worked for me also because I was prepared. I had my little savings, I had my disability insurance, and I was set up. So everybody in here, just in the same language that we can go together, if you look at your finances and where you're at, that's where you're focused. But again, you can't take that with you if something happens to your health. So I'm hoping today that you realize that it's just as important to set a base for your health. So I'm going to go over some statistics with you and go through. Now, I know and I understand that it's very hard to start. And you heard on the little video there, the heaviest weight at the gym is the front door. It's hard, right? It's also hard to be fat. Choose your heart. It's hard to be lonely. It's hard to make friends. Choose your heart. It's hard to be stuck. It's hard to get up and move and to change your life. Choose your heart. So where are you going to go from here? How do you start? Well, being minded in the fact of finances, we can look at data. Everybody in here, you know your data of your company. You know what's coming in, and you surely know what's going out. We cannot master what we do not measure. So there is an epigenetics hair follicle test that we do. It's 3 to 4 little baby hairs in the back of the neck, and we take it from the nape of the neck here, and we send it out to our facility that was from Germany. There's only one in the United States, and it measures 800 biomarkers. So it looks at everything from your gut biome, so your intestinal system. It's going to look at your immune system, your cardiovascular system. It's going to tell me if you're deficient in nutrients, vitamins, amino acids. It's going to tell me if you have parasites. Okay, so this is the least invasive and the most extensive. And what I can do from there is I will then match it with blood labs and see what we have. We can build upon that. There's different tiers. So we can optimize your health with glycans, which are your normal, like vitamins, your amino acids, so on and so forth. And then we can carry it to peptides. There's been so much talk about peptides. Let me tell you, I've been doing my homework and I've utilized them to get better. Now, I can do everything and anything. I can run with the best of you. I can lift any type of weight. My husband back there, he makes me go to the gym all the time, CrossFit. But those peptides, they went in and they helped heal. They helped heal my shoulder, my pelvic, my head, everything. I was a mess, but I also took my own health and I decided to be the CEO of it and make the decision that it was just as important to master that as my finances. Because in the end, it's not going to matter. You don't have your health. So the 50-year-old that has the heart attack, that started when you were 20. The Alzheimer's at 75, that started when you were 40. That tinnitus in your ear, that started when you were 15 years old. How do we reverse that? We go above genetics, epigenetics. Dr. Sanfrobi and I are starting another tier of Carrera Telehealth and Wellness. It's called Above Genetics. We will do all this data, we will do all this measuring, and then we're going to educate you. We're going to have providers on once a week. We're going to have attorneys. We're going to have psychologists. We're going to have live webinars that you can become a VIP member of. You will be able to embrace the fact that you have all the resources you need. We will go over peptides with you. We will tell you about stem cell therapy. Every question you have, we are going to be a resource, and it's from a licensed medical provider. It's not off of social media. God bless every social media, every person that's putting things out there. I appreciate that because they're making noise. Come in July, Robert F. Kennedy Jr., he is going to go ahead and he's going to release these peptides. Now, as a licensed clinician, it is in the best interest of you, and we go over and we tell you it's research, use only, RUO, but you still want to go ahead and you want to do some of these peptides, then yes, we can go through and we can use a compounded pharmacy that has a license, that has a certificate of analysis, and that checks all of them for endotoxins. But we have to look at you, what's relevant for you, what's specific, what meds you're on, what history you have, how your kidneys are working, how your liver's working. We want to know how to stack them. We know what time of day to give them to you, so on and so forth. So they are safe, because that's most important. I know all of us have come and we all have some type of history, and I don't know specifically what it is, but I'm very willing and I'm very open to one-on-one go through it with you. Your DNA is not your destiny. Your daily decisions are. So just remember that. I have some, and I'm gonna ask my husband if he would be so kind. I have some brochures, yeah, and it's just a daily newsletter. If you could pass that out to everybody. But it's basically going over, it's know your numbers, it's data over guessing. So a CEO doesn't guess, right? At Carrera Telehealth and Wellness and Above Genetics, we teach you to understand your labs, your hormones, your inflammation markers, your epigenetics. And I think it's really funny because we're gonna change it here. Guys, tell me the truth. When you used to see a girl that you wanted to date, you thought she was hot. you would say, ooh, let's look at her mom. Because we can see what she's gonna look like in 20 to 30 to 40 years, am I right? Okay, true. And then sometimes you go, and you walk. Am I correct? Okay.
So the grandma was a plus.
So you can't do that anymore. Not with epigenetics, because that's going above genetics. So we're going to be able to go in there and flip the switch. So we're going to be able to help turn off the aging mechanisms, right? We're going to be able to help turn off when your inflammation markers are up. This is all with peptides. We're going to be able to switch it, turn it around as far as carcinogens, where possibly your parents, they had history of cancer. It's your environment. It's your support system. It's your stress levels. Again, going all the way back, we look at your sympathetic and parasympathetic nervous system. And so important to make sure that you're in a state of parasympathetic nervous system, to where you're calm. Because anything that we're gonna give you, or I would give you, you have this cell and it has receptors on it. That cortisol level, if you're always in a fight or flight status, it's gonna hook onto all those receptors, okay? All those tentacles hanging out. So we gotta remove those. We gotta reboot that. We gotta clean that so that everything that I'm gonna give you will actually enhance and make you feel better. We go into the mitochondria of the cell, which is the engine. So picture this, you have a car, okay? You guys can all relate with this. And then in the car is this engine, and it's a beautiful car. But as the years go on, and you're not turning that car on as much, or you're overusing it, that engine starts to puff smoke, right? And it's not working as well. We have coenzymes that will go in there and repair the mitochondria. And when that happens, that baby purrs when you turn it on, right? That's what we want. And then you feel this incredible energy. They were talking about MOTS-C earlier. That's a incredible, fantastic, which hopefully will be blessed this July to come out and for everybody to use. But you want somebody that's an expert and a licensed provider. Why? Because a lot of people don't tell you, if you take too much MOTS-C, that's like putting the gas pedal and revving it constantly. And what happens? It's going to give you a form of anxiety. It's going to put you in overdrive. So you need the right dosing. You need to get it from somebody that's a licensed provider and an expert and that understands this. Because you're going to be battling anxiety for having all this energy and you're not going to understand why. So this is just an example of why it's super, super important. So know your data, know your numbers, build a strategy, not a Band-Aid. So normally when you would go into your primary care, it's very important. I want you to have a primary care, somebody in your state, because you have to have somebody that's affiliated with a hospital. God forbid something happens like it did to me. I was able to call my primary care and they were able to collaborate with the physicians in there. If not, we also have a program Dr. Cicropia will tell you about, and I want to bring him up here in a second so that he can elaborate. He will be your CMO, meaning no matter what happens, he will call any physician or provider in the United States and make sure that you have optimal care. I will be on the other end, making sure that you daily are taken care of, or if you're traveling, if you need something, our teams will work simultaneously. So build a strategy, not a Band-Aid. And number 3, audit your inputs. What you eat, what you drink, what you think, what you absorb. So again, it goes back to that data. So I don't want this to just be a one-time. I want this to be a lifetime. It's not about quantity, it's about quality. So wherever you are in your life stage, and you think this is just where I'm supposed to be, no, it's not. I have so many testimonials, and you can go on my website, of lives being changed and people resurrecting and feeling so incredible. Super, super, super important that you start now, because again, we can go above genetics. We can flip the switch. So I'm hoping that you guys know that in the future and in the near future, there's going to be a lot of noise about these peptides and regenerative medicine. And you, at this point today, have firsthand access from an orthopedic spinal surgeon. Find me somebody at his level and his education, and someone that has been teaching and prescribing peptides for many years now and understanding the system and where we need to be. It's at your disposal. So your transformation happens now. I would like to have Dr. Sinekarpi come up just for a moment too. I think it's important. Introduce him, yes.
Thanks. Thanks, Danielle. That was fantastic. Hello, everyone again. So just really briefly, it's so interesting how much we're talking about peptides today. So it was fantastic. I didn't realize that the Greenfield was going to just focus on peptides so much. I can't even explain to you how controversial they are, but they're generally very safe if they're done by qualified medical professionals. She's been doing it for a long time. When I met her, I was just blown away by her knowledge and her teaching ability and what she was doing. So clearly it was a natural thing that we were going to do. We were going to, build something together. I will tell you that currently the American health, I'm an insider of insiders in American healthcare. I'm not coming to you guys as some conspiracy theorist or just making stuff up. I'm certainly not an influencer, okay? Even though some of the influencers are really starting to love me on social, they're like, yeah, that's the doc that's with us. I'm like, well, it's complicated. That's a complicated issue, but I'm just saying I've been a CEO for a long time in healthcare. I've negotiated contracts with all kinds of hospitals. I sit with hospital CEOs and insurance company people, all these people, and I can just tell you that our system is not designed to keep you guys healthy. It's not. I think everyone in this room has a good sense of that. So one of the things that I say in my talks are you think you're being assessed, but you're actually being processed in the medical system. 90% of the money that we spend is on sick care. So we're treating you guys when you get sick, like really sick. That's why the medical ICU is full. And what you were saying about this stuff happening before, like, right, we call Alzheimer's disease now type 3 diabetes. It's metabolic dysfunction. And some of you out here, you feel healthy, you feel pretty good, but inside, it's a ticking time bomb. And guess what? I see you when you're in the emergency room really sick, okay? You might have something else going on, but then, you fracture your spine, but at the same time you have a heart attack because you're so sick, you can't take that stress. So there's so many things going on. And so I think that understanding that we have to take note and actually know where we are. That's why these tests, like these epigenetic testing, is one of the best tests you can possibly do. You know where you are. Think about how many times we don't want to know where we are. We don't want to be like, oh, I just have a couple more pounds, whatever. I'll figure it out another time. You got to know where you are. Otherwise, you can't do anything about it. It's like running a business and not having an accountant and never looking at the books. That's what we do with our own lives. So I think, you have the opportunity to do something like the genetic testing, get a baseline, and then we can start thinking about how do we fix this body. It's complicated. You're not going to get this stuff through traditional medicine. It's just happening. Even cardiovascular markers, like just looking at LDL, half of the heart attacks that happen, normal LDL. But yet, some of their apoproteins are way off. We could have known this a long time ago. We could do all kinds of treatment for you to prevent that heart attack. Yeah, homocysteine is huge. This methylation pathways and all these other things. So that's one thing. So if anything you take out of this is really know where you are so that we can help you. The last thing that I would say is, as she mentioned, the kind of the chief medical officer, one of the things that I'm really passionate about, because I see it all the time, and I've talked to Tim about it, and I've talked to all kinds of people. Some of the most successful people in the world I've talked to, when they've gotten in trouble themselves or their family members have gotten in trouble, they don't know what to do. Sometimes even all that money can't get you the right care. You don't know if you have the A team or the B team. I can tell you the difference between the A team and the B team, if you're in trouble, is life and death. It's life and death. I've seen it. I can't even tell you how many people I've seen people die in the hospital because of idiotic decisions that are made because people don't know. And AI we're not there yet where AI can say, oh, this guy's making it. I mean, people make big mistakes. So in the CMO program, that's one where if you come into it and say, you know what? I'm very successful. I've got this business. I've got all these other things going on. But God forbid I get sick. What am I going to do So when you bring in a chief medical officer, you have somebody then that can help guide you through the path, that is an insider and can really communicate with anybody, in the thing. So using resources literally all over the world. So I could just give you an example. Like, there's a woman that I met, recently, that was in a horrible accident, actually similar to yours, pelvic fracture. She broke her knee, but she also had a traumatic brain injury, but was not in the state that she lives, and was trapped in this hospital for 3 months. And I met her, and she's now working with me. And basically she said, I'm never doing that again. I was completely alone. Her family was trying to make calls. They had no idea. And it turns out that they really weren't taking good care of her. And they almost, because she's like, they were trying to kill me. They were trying to kill me. And I'm telling my physician, I'm like, kind of. With what they were doing. So it's very, very scary. So what we would have done in that situation is we would have reached out immediately to her medical team. What's the neurologist doing? What's the neurosurgeon doing? What's the orthopedic surgeon doing? Who's running this hospital? Whatever. Been able to connect her with potentially other team members at that hospital, or arrange the transfer, or gotten them on a Zoom call with the leading people in the world to discuss that case. And you can't do that on your own. You need providers to provider, because I can tell you, docs reach out to me from all over the world, like with questions. I always answer them 100% of the time. That's what we do. That's professional courtesy. That's like a cop calling another cop, or a guy in the CIA calling a CIA guy. You're going to do that out of professional courtesy. But having that ability, that CMO program gives people an opportunity to really be able to navigate the system, because it is one of the hardest, most complicated system to navigate. It's probably harder to navigate that than like the tax code. It really is hard.
Yeah, yes. To reinforce this, the day after I went home, I got notified that the orthopedic trauma surgeon that did my surgery, he had left the practice and he was overwhelmed. There was a whole bunch going on. So my follow-up appointments got moved. Well, I had sutures in me, and you have to get them out. After like 2 weeks, they start to like embed in there. So, and they can become infected. So I tried to get in, they moved me again. I'm a provider, and I couldn't even get in for them to take out the sutures. So what did I do? I took a mirror, propped myself up, and I took the sutures out myself. But the layman person is not gonna be able to do that. So the system even failed me. And I had multiple friends that were physicians and PAs and nurse practitioners, and I couldn't get in. So think about that. It's super important that you have somebody on your team, somebody that's strong enough to know and has enough contacts and the credentials to get you where you need to be and who you need to see in a quick time and not waiting. So I wish I had you on my team at that time.
I'm on your team now.
I know.
So, I would say just one quick thing you touched on it on this above genetics thing. What you'll be able to do, if you guys are interested, and we got some stuff, is you can come into this online community that we're building. We're going to be doing webinars weekly. We're going to be doing live events. We're going to get like amazing people on there. And if you're part of this community, literally you can just hop on. You'll have access to all this stuff. You'll see experts from all over the world talking about different things, microbiome health. I've had all these guys on like my podcast and all this stuff. So everybody wants to contribute all kinds of information, because most providers, they just want to get their knowledge out. So you'll have access to that. You'll have access to other people that are inside of these communities. So say, hey, I have MS. What are you doing about it? What are you doing about it? Hey, I'd love to have an MS expert on. We'll get some of the leading people on the world on there to speak to you guys. And it's just, it's really where you get good information, as opposed to just scrolling on Instagram and what comes up, and next thing you know, you're just in kind of a silo. So we're really excited about it, and thanks for calling me up.
Yeah. So I have some brochures on both above genetics to be in that VIP program, and then also for the epigenetics, if you guys want to do that for the hair follicle test, and it'll be shipped directly to your house, non-invasive. Get your child, get your significant other, whoever, to take 3 or 4 hairs just from the back. Again, ladies, you don't have to rip out your very long hair. Get the baby. If you're bald, if you have no hair, you can use your eyebrows. Nothing below the eyebrows, though, please. Okay, so that's it. Guys, Guys, you see you grow the hair back here on the back of your neck, and you can pull it off there if it's like right at the hairline.
So in America, if you guys were to study this, you'll see that just over 1% of Americans live past the age of 90. So this is very, very interesting to me because in the world that I'm in with 10X Health, Ben Greenfield, all these countries I go to, especially in Europe, all talking about like living forever, over 1%. In Japan, right at about 3%. Okay, so let's go somewhere interesting for a minute. Is it possible to pass away healthy and we just check out? And how do we get to that place? Because of my spirituality, I've seen many people that got older and said, I'm done.
Yeah.
And they sat on a couch and they were gone. That's how I want to go. I don't think we have to deteriorate down to sicker,
Right.
more broke down. Go there with me just for 3 minutes. The next speaker's about to come up.
Sure. So my mom is 80. She looks fantastic. She can run circles around all of us. It's insane. It's incredible. My younger brother has a second marriage and he just had a baby. So Wilder's 1 year old and mom's 80. My mom said, I am going to live until he graduates high school and I'm going to live well. So she has a goal, she has a timeline, and she has a purpose. So I think that's what we need to do.
Ooh, I like what you just said. Put those things in. A
A
goal?
goal, a timeline, and a purpose.
Yes.
So she is embracing that, and I think that's for everybody. You have to have that clarity. You have to, because it's just a dream until you set a goal, and you have to put a date on it.
So are you going to help us, though, to
Get
be
there?
healthy?
Yes. It's not.
I don't want to break down in this. I want to be super strong like this. You with me? And then at a certain age, like my mother's 95,
Right.
and I want to be watching ESPN, and I want to hear da 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 da, and bam, all. I'm ready to have it. It's possible.
Be the
Okay.
game changer. I'm ready.
Can we give her a big clap?
Go ahead, some nice bit. Talk, you know, take the